If you've been in a car accident, it's common to think, I'll wait and see how I feel in a few days. This can be a huge mistake, even if you think it was just a minor accident. Many injuries can go unnoticed immediately following a car accident. During a crash, the tissues of your neck can be stretched or torn, resulting in a sore, stiff neck the next day. During a rear-end collision, the car seat can rapidly straighten and compress the lumbar spine, resulting in ligament and nerve injury. A number of studies have shown that when a patient gets early treatment, they can have a much better outcome than those who wait. Stiffness and pain are signs of trauma. Your body can begin repairing the injured area with scar tissue. Not receiving proper treatment quickly could result in permanent limited mobility, chronic pain, or even deterioration of the joints. If you've been in a collision, contact us right away for a chiropractic evaluation. We're experienced in treating auto collision injuries to help you recover from injuries like whiplash, headache, neck pain, or back pain. There's more you should know about why you should consider us for chiropractic care. Chiropractic care is normally safer than other treatments because patients do not have to be placed in a sedated state and undergo surgery to get results. Nor does chiropractic involve the use of harmful medications and their toxic side effects. Contact us today so we can help you on your path to a happier and healthier life.
Okay, sir. So please tell me, how did the injury happen and what exactly happened?
Coming from the store, stopped at the intersection of Callahan and Bancroft.
In San Leandro?
Yes.
Uh-huh.
Waiting for the light to change there. People are crossing the street. There's a car in front of me. There was no one behind me. We were sitting there, maybe been in there about 30 seconds or so, and then all of a sudden, bam!
Okay. So was your car moving or was it a complete stop?
Complete stop.
Was it the red light?
It was, yes, red light, waiting
Okay.
for it to change to green.
Mm. Okay. Did the police arrive?
No. So what happened was, after she hit us, it was like she gassed the car, was pushing the car. Okay, so I don't know, what happened on her end, but another 15 seconds or something goes by or something. Then the light changes. I immediately find the next place to pull over. I pull over, park. She parks behind me. First, I didn't get out. My passengers got out. Then I got out to see what was happening. Talked to her a little bit.
Okay.
Started feeling like queasy. I thought it was nerves at first, but then my stomach started getting upset.
Okay. You probably have a minor concussion. Did you vomit?
I felt like it the whole night, almost.
Okay. You probably had a concussion. Did the airbag deploy?
No airbag.
Okay.
I had seatbelt on, which caught me from going forward.
Well, that's good. And you mentioned us. How many more people were
One
there?
passenger.
Okay. Is that the person going to come here as well, or do you don't know?
They went to the emergency room. They're being seen by their physician, so they'll make the determination what they're going to do after that.
Okay. Was that your relative or something?
Yes.
Okay. Well, we'll talk about it later. So you said you went to, were you taken by an ambulance to emergency room, or
No.
did you drive?
No, I drove home.
Okay.
That's what I did. After they exchanged the information and talked whatever, because I didn't even talk to the woman. I didn't feel well.
Okay.
I just wanted to get home where I, could lay down or something,
Okay.
sit down. So I wasn't feeling well.
Mm-hmm.
So after about an hour or so, I called the insurance because there was damage to the car. They took the initial report and everything, and then she said the adjuster would be contacting me. So I started getting a headache,
Okay.
and then it started getting worse, like a migraine type thing.
Mm-hmm.
So I went to bed because I said, my stomach's
Okay.
upset and my head's hurting. Woke up 4 a.m. My neck is stiff, my back is hurting, my stomach is still hurting, and I've got a headache.
What about nausea?
That's what I guess. I guess that's what nausea is, when your
Okay.
stomach is feel
Okay.
like you just can't, you can't do anything, like you're seasick or something.
Okay.
So that morning, I'd say about 7 in the morning, I went to the emergency room.
Which hospital?
This was a Highland Hospital
In Hayward?
it's in Oakland.
Uh-huh.
It's like a trauma
Okay.
hospital. So I went there. I saw the doctor. She did some tests on me,
Did
feeling
you
my
do
hand.
x-rays?
Yes, they did X-ray, CT scan.
CT scan or
Yeah.
no x-rays, right?
One or two X-rays and then a CT scan.
Two x-rays. Which body parts of the x-ray?
Neck, back, and lower back.
Okay, and CT scan, did they scan for anything?
My head and my neck.
Okay. And no evidence of fracture, right?
He didn't see fracture. They said the nurse said something about a bone spur.
Okay, well, that's osteoarthritis. That's probably most likely not related to the accident.
But what they did say was whiplash, and it would probably get worse before it got better.
Yeah, whiplash injuries, they're no fun. I mean,
Yes.
and whatsoever. So let me just ask you a couple more questions before I get to the point where I explain what happened to you.
Yes.
So basically, what's the level of pain in your neck, 1 to 10?
It's pretty much that has stayed the same.
10? Is that 10?
It was like it's about an 8. I'd
8?
say,
Okay.
because of the headache coming and going, and you know I can't do any picking up anything or anything. I haven't been able to drive since.
Can't focus on the road.
I mean, it's just not concentration is not good.
Okay. What about low back?
Yes, that was really bad. It was like almost like it's stiffing up on me.
Is that 8, 9, or 10?
I say everything's still about an 8 or 9, 8.
Okay. Did you miss any time from work?
They gave me 8 days off from work.
Doesn't look like you're ready to go back.
I'm just not feeling comfortable. I'm just, trying to get some relief.
You look like you're in a lot of stress and a lot of tension.
Well, yeah. It was a shock getting hit from behind, not knowing it's coming. But then the next day was like the worst thing ever. So, So, from the radiologist and the nurse and the doctor that did see me, they all came to the conclusion of whiplash.
Well, it is whiplash, yeah.
Their recommendation was just come see my own private doctor and take it from there.
Okay. So did private doctor recommended chiropractor, or you just made?
I just know from in the past when I had this kind of feeling in my neck and back that won't go away, that produces a headache. It comes and goes like this. That it's usually because I'm out of alignment or my neck is out or something like I know there's something wrong.
Okay. Now, give me a second. Does this hurt?
Yes.
It's very stiff.
Yes.
It doesn't move at all.
It doesn't want.
The pain gets worse when I press here?
Well, yes, right when you just squeeze right there, but it like stems from back in here
Okay.
and on this right side here.
Yeah, it's a suboccipital muscles. They usually get tied up.
And it's going down the back in between the shoulder blades there.
Right there?
In there, yes.
What about this? Anything
And then
else?
stops. You're going so fast. Right there.
Worse on the left than on the right?
Well, it kind of shifts a little bit.
Okay.
But I think the right side got the brunt of the force.
Okay. And more here on the left or on the right?
I think it's the right, man. It's the right.
Okay. Okay. Bend forward. Okay.
I noticed putting on my pants and my shoes were kind of difficult.
Stand on your feet, please. Face the window. Okay. Right in place, like this. Okay, stop. Yeah, pelvis is really out. This injury. Did you say?
Here is like.
Yeah, the right side is.
Yes,
is out. Have a seat, please. Okay. Yes. So basically, your doctors they were correct. What happened to you? It's called a whiplash injury. Basically, what it is when you sit in a car. During the collision, another vehicle hits your vehicle from behind, so the force moves your vehicle forward.
Yes.
But as a result, this force moves your vehicle forward, but you don't have enough time to react, so your muscles will relax. So your neck is basically, oops, this is turned around. Your neck is basically jerked really fast backwards, and then really fast forward. As a result, all this, all you see here is the bones and the nerves, but you have like muscles, ligaments, and tendons. All this massive soft tissues that's attached to your spine and to your skull, they basically, what happens to them, they tear up. And naturally they're trying to heal back, but instead of healing back the same way like they were before the injury, they heal back like this, and they create these trigger points. That's the medical term. As time passing on, at this particular point, we're talking about 9 days.
You're right.
They get larger, and when they get larger,
A big knot that I had.
yes,
in
that's
my-
the trigger point. That's the knot I'm talking about.
Yeah.
It gets larger, and as it gets larger, it makes your body stiffer and more pain.
Right.
And you feel like your symptoms got progressively worse, right?
It feels like I can feel them more.
Yeah, it's gonna get more. You're gonna have more symptoms if it's not gonna get resolved, and we're gonna resolve it here. Okay.
Thank you.
So basically, what I found that the right side of your pelvis is about 1.5 inches lower than the left side, and then the rest of your spine is kind of compensating. So we need to fix your pelvis. The left side of your lumbar is out. We need to fix it here. We need to fix your middle back, and we need to fix your neck. Okay. Unfortunately, it takes about a second to get injured and about 100 days to get healed with proper rehabilitation. It's a very slow process. So when you come here, I'm going to be seeing you for the next couple of months to get this fixed, okay? But we'll see how you respond after this first treatment and see how it goes.
Because I definitely knew I needed to be seen and needed treatment.
Okay.
I just didn't know how extent or how my body's going to react.
Okay.
because it-
Well, you're in the right place. I mean, I've been doing this for 15 years, so I've seen
Sure.
a lot of injured people. So we're gonna get this result. So each time you're gonna come in, basically, you're gonna get 4 different procedures. You're gonna get the electric stim, which is that interferential unit. It's gonna be 15 minutes sending the electric currents to your soft tissue that's have been injured. And what it does, basically, it's expediting the healing process. And then I'm gonna use that hot blanket, and that will bring more blood to the injured areas and help me to relax them, and also bring more blood to the injured areas to also expedite kind of the healing process and soften them up a little bit. Then I'm going to give you an adjustment. Sometimes with this therapy, if the injury is severe, like in your case, I'll send you to a massage therapist first to loosen you up even more,
Sure.
and then I'll give you a full spine adjustment, okay?
Okay.
And then we'll schedule the sequence of visits to follow up, okay?
Sure.
You look like you're ready to go.
Yeah, I've been
You're ready
waiting
to
to get a scene and get
Yeah.
something done.
So basically, I'm ready to start the treatment. I'm just gonna explain it to you what's going on.
Okay.
And so before I proceed, do you have any questions?
No, I guess.
Just fix me up.
Yeah, I just want to
Make me feel better. Okay.
Yeah, I just hope there's nothing. I don't. It wasn't too extensive. It's gonna be.
Well, the most important thing, there is no fracture. If there is no fracture,
Right.
that means we can move forward and just fix you
Okay.
up. Okay.
Sure.
All right. So I'm gonna set you up for hit and stim, and then most likely I'll send you to my massage therapist afterwards, and I'll adjust you. Okay.
Okay.
Did the girl loosen it up here? Loosen it up a little bit?
Yeah. I didn't really
Go back
realize
here.
how much you knotted up until that.
Sit here. Lean back. Go ahead, line your stomach face down, please.
Oh man.
That moved.
Yeah, sure.
Okay.
Oh boy.
Slow. I know you're in a lot of pain. Lean back a little bit. This paper here. Okay. Put your hands down. Okay. Take a deep breath in. Out. Okay, right there. Out. Okay, right there. Out. Okay, good job. Go on your side, face me, please. Relax your shoulder. Relax your shoulder. Okay. Do you feel that move?
Yeah.
Okay, sit up. Okay, come on. You like Beatles?
Yeah.
Classic.
Yeah.
It's like Pink Floyd.
Oh yeah.
Okay, stand up first. Okay, go ahead, lie on your side, face me.
Face.
Yeah, legs over there, head over here. I'm gonna adjust your lumbar spine. That's your shoulder. Oh, that was a big one.
Did you feel that?
Of course I feel it. It was under my hand. Stand up. All right. How does it feel? Stand on your feet. You should be a little bit more loose.
It's my head. It's, like the pressure in my head is what.
Just loosen up.
Yeah, just let me sit for a second. That was awful quick. Let me just sit down and absorb it for a minute. Yeah, I didn't really realize how knotted up bad it was till she did that, the massage.
With an elbow.
In all the places, she was saying, oh yeah, she was just looking and saying, I can see where it is. So, that really helps.
That's good.
Yeah. So I know you definitely felt that last one.
Oh yeah,
Was,
I felt all of them.
Yeah.
The neck was loud too.
Yeah, that's like the whole thing just went, all the way. You got it. I still say that the right side got more. It's
Yeah,
it feels like
it's gonna take some time. Like I said, this is a big injury. It looks like so probably 6 sessions before you start feeling some drastic improvements. But it's just gonna take. We're gonna take it slow.
Yeah, I just don't want it to be like long period of time. I'm hoping that we'll get it.
Well, I'll get you. I mean, I had people rolling in wheelchairs in the past. We were able to get them going. So
From accidents.
yeah,
That's terrible.
yeah, people couldn't walk.
And the thing is, I can't tell you what exactly she did, and I can't tell
It doesn't matter.
how fast she was going.
Yeah.
It's just that it was the initial bump, and then she was pushing.
It's just a whiplash, that's all. People don't pay attention. They text and drive, and we just like.
She was 85, 90 years old.
Oh jeez.
So she may have got confused or something like that. I don't really know. I couldn't talk to her. I didn't get the story from her.
Okay. Okay. Stand on your feet. Okay. A little bit more loose.